Take Charge Parenting with the Kids Doctor is brought to you by Children's Health.
The statistics are sobering. 1 in 300 children can expect a cancer diagnosis. Children's Health is leading the way in the fight against childhood cancer and blood disorders. Here with much more is Dr. Sue Hubbard, an award-winning pediatrician and medical editor of KidsDoctor.com, and Dr. Tanya Watt, a pediatric oncologist at Children's Health and assistant professor at UT Southwestern Medical Center. Welcome. Nice to have you.
Hi, Jane.
On not such a pleasant subject, but one that is really important to a lot of people. Dr. Sue, as a pediatrician, I would think cancer has to be the hardest diagnosis you would have to give to parents. I can't imagine.
It is devastating for a family, and as we talked beforehand, you're physically sick almost as going into the room to deliver this news to a family. But knowing in the back of my mind that I have fabulous resources at Children's Health with brilliant doctors who are not only going to treat but hopefully beat their child's cancer makes the discussion only slightly easier.
There is so much hope these days.
So much optimism.
Okay. What are the most common childhood cancers?
About a third are caused by leukemia, blood disorders, and then another 25% by brain tumors, and then others called like neuroblastoma and Wilms tumor that Dr. Watt can elaborate on, but leukemia is still the most common.
So, Dr. Watt, what's the differences between like a childhood cancer and an adult cancer?
Sure. So adult cancers, we think about lung cancer, breast cancer, colon cancer. We don't see those in the pediatric population at all. We're fortunate in that a lot of the pediatric cancers tend to be a different biology, so more immature, which allows us to give better therapies and allows the children to be a little more responsive to the therapies. The big challenge, though, is still that we have children that we expect to live 7 to 8 decades more, and so trying to make sure that in our therapies we're not altering their life expectancy and changing things, assuming they survive.
So your team at Children's Health is leading a charge right now to fight childhood cancer. What are some of the latest treatments that we may not know about?
So what we've done before in the past has been use things like chemotherapy, radiation that everyone hears about. Those target all cells that are growing fast. And what we find with that is that you end up with a lot of side effects, and you end up with children suffering many more times than they necessarily need to. So newer therapies are really focused on targeting and actually trying to attack the cancer cells. So we have things like immunotherapy where we can target markers on the cancer cells and allow us to actually go in and just kill the cancer cells and not kill all the surrounding cells. We have things like CAR T therapy that's really revolutionizing leukemia, and so that allows us to actually engineer patients' white blood cells and make it so they can fight the cancer cells themselves. We're becoming smarter with our radiation therapies. We have a new facility opening for MIBG therapy for neuroblastoma, all things that basically are targeting cancer cells.
Tell them what MIBG.
Sure, so it's actually a targeted radiation therapy, so it allows us to go in and just kill the neuroblastoma cells and not the remainder of the cells.
I'm going to guess, I don't know if I'm right or not, but with all the research being done in North Texas that we're on the leading edge of this, I'm going to guess that the survival rate has increased over the years. I hope that's right. Is that right?
Correct.
Yes. So we used to have survival around 50% back in the 60s and 70s, and now we're pretty confident that we can achieve 80% survival for all children's cancer diagnoses.
And one of the best news, I think, is that after the cancer is overcome, the outlook is pretty good. Is that right?
It's really good for most children to have a normal lifespan. I think the nice thing, too, is that you are continued to be followed by these fabulous doctors and researchers at Children's, and so you continue to go back and be reassured that you're doing well.
Correct, exactly.
Well, we're very appreciative to have one of the best centers in the country right here.
We're lucky.
In North Texas. We are, in fact. Thank you, Beth, for coming in today. You can log on to childrens.com/cancer for more information on diagnosing and treating childhood cancers and blood disorders. You can also follow Children's Health and the Kid Doctor on Twitter and on Facebook.
Just like you're always by your child's side, we're Children's Health, and we're by your side. Visit any of our 40 locations for exceptional pediatric care.